Thank you, Mr. Chairman, dear colleagues. So we are surgeons, and I think we talked about the last 2 days mainly about surgery, but I think many of you have patients in the outpatient clinic, you're thinking about surgery, and when Jean-Marie Wilm, one of our board members, read the title, he provided me pictures from 3 patients I will show you, and in these patients he asked, do we have to treat anything? I think if you see the couple of these patients, there's no doubt about that all of these patients need a treatment. But you will see some of these patients later on, and some will be corrected by surgery, but some will also be corrected by a non-operative treatment. That's the first patient from Jean-Marie. He said, 19-year-old patient, he came to this outpatient clinic and he asked for surgery. So he said he will do nothing. Second one, 24-year-old patient. He's an artist on the street and he is used to work with a naked body. So he wants to have an improvement of his shape, and he came to the outpatient clinic of Jean-Marie and asked for a surgical correction of his pectus. And again, the third one, 27-year-old patient, was also seen by Jean-Marie, and he said, he told me, show the audience what they are thinking about. I will show you one of my recent patients at the age of 7 years. He was referred the first time to ask about any treatment options, and I think that's a good example that you may see the patients and you may follow up the patient, and it's important to follow up these patients, but at the moment there is no treatment necessary. Coming back to a couple of patients, and 50% of them had surgical repair of the deformity, and the other 50% had conservative treatment. So I hope you agree that you see not such a big difference between surgery and conservative treatment. Sometimes you see a scar, of course, no doubt about. Sometimes you don't. So for the non-surgical treatment of pectus, we have still the recommendation to do physiotherapy in sports, and also Rebus told us yesterday, demonstrating the pectus press, this physiotherapy and body posture is an important aspect in addition to the compression. We're talking about the vacuum bell, no doubt, and we have the semi-conservative or semi-surgical maneuver of the magnetic mini mover. You've heard yesterday the presentation about the pectus press to correct mild degrees of pectus excavatum. And I think with the years we have an increasing number of different devices for the conservative treatment of the carinatum. I think many of you know the FMF system from Buenos Aires, but we have also in the United States the increasing number of companies offering different devices for the specific treatment of the carinatum deformity. When I had my first paper 13 years ago, you see on the map, that's the feedback within 2 years about the interest of the vacuum bell. So even 15 years ago, there was a big interest also to have a non-surgical treatment for pectus excavatum. I think for the North American market, it's still an important aspect that the group of Norfolk, that time Donald Nass and Rob Kelly, included this type of treatment in their pectus program. And 1 year later, we had the first workshop on conservative treatment of pectus carinatum with Marcelo Martinez in Buenos Aires. The next year, we had the first workshop on conservative treatment in Paris, and although the Phoenix group included the conservative treatment method into the pectus program. And the last session we had 2 months ago, a chest wall panel at the annual IPEC meeting this year, and 50% of the program included non-surgical treatment of chest wall deformity. So if you go to the history of brace therapy for carinatum, I think we have to mention and to remember Dr. Haecker, who reported the first in a written form 30 years ago, 40 years ago, and 25 years ago in the English language. And I think a milestone was the first paper from Marcelo Martinez 10 years ago about the experience of the Buenos Aires group using the FMF. And just giving you the why it's called FMF, it's Frere Martinez Ferro. It's very simple. Sometimes life is easy. And if you start with a new treatment method, it's, for me, as I started with the vacuum bell, it's helpful if you find colleagues who make similar experience, and it's a confirmation that you are on the right way. So Manuel Lopez, at that time in France, now in Barcelona, reported his first experience using the FMF, and I will show you our results later. So the next important aspect we talked about this morning, if you start with a surgical procedure, it's very helpful to have the people with you, but I think it's not only for surgery, it's also if you have the conservative treatment, and this slide shows you, it's 5 years ago when we started in Switzerland, and Hans came to us, joined us to have the experience, bring it to the northern part of Europe. Coming back to the excavatum, I think for the modern history, it's our 2 papers. The first one was from Felix Schier, and a couple of months later from our group. And again, in the meantime, we have increasing number of people who uses the vacuum bell and who may confirm the results we had. And the latest update is summarized in this very nice book. Coming back to the carinatum, we published our results, and you see, coming back to the question, do we always need surgery? We published a group of 68 carinatum patients, and 2 had surgery. So the remaining 66 were treated conservatively. And you see 2 treated conservative and 1 was operated on, and I think if you compare the results of these patients, they are comparable in my mind. So you see, this one is a little scratch, that's its nose scar. You see here the scar. These both are treated with the FMF, and this one was operated. I think one important aspect is the age distribution. So I'm a pediatric surgeon, so you see the patients at a younger age than some of you as a thoracic surgeon. And it's the same again. My study group with the vacuum bell patient, you see, we started 15 years ago with the routine application, and within 12 years we had an increasing number of patients. The age distribution again, children, adolescent, young adults, and to give you an idea, we had in a longer time period about 150 patients who underwent surgical repair, but more than 550 in the meantime who came for the vacuum bell. One important aspect I showed already yesterday, it's the flexibility, and we developed an electronic device to measure the correlation between the negative pressure and the elevation of the ventral chest wall. And we could demonstrate that we have, of course, a significant correlation between the depth of pectus and patient's age, and we have a positive correlation between the age and the required differential negative pressure to elevate the sternum. That means the younger the patient, it's easier to elevate. And again, positive relation between patient's age, depth of pectus, and the required differential pressure. So the sequence, depending on the patient's age, the differential negative pressure required to lift the sternum is lower or higher. The duration of treatment is shorter or longer, and the chest wall is more flexible. So coming back to this question, I think specific treatment is not necessary in every patient, but you have to follow up the patient. And all the other we already mentioned. In our patients group, non-surgical treatment is more common in carinatum patients than in excavatum patients. And I think it's useful to know all the famous people, and I feel privileged as an honor. And coming back, I think we have to define objective parameters to indicate non-surgical treatment, especially in excavatum patients, and we have still to work on objective parameter to define the definition of success. Thank you.